everyone, welcome again to this channel. My name is Oriana and I will be your guide on this educational journey. Today, we will be exploring a topic that impacts both patients and healthcare providers, authorizations for healthcare services. In this video, we will shed light on what authorizations for healthcare services are and how they can significantly impact medical billing and insurance coverage. Have you ever wondered what an authorization for healthcare services really means? How it can affect your medical billing and insurance coverage? Well, you have come to the right place. Let's delve deeper into what they actually entail and how they can impact your healthcare journey. What is an authorization for healthcare services? An authorization for healthcare services is an approval process that ensures that specific medical treatments, procedures, or services are approved and covered by an insurance provider before they are rendered. It is typically required for non-emergency or specialized medical services to ensure that the insurance company will pay for those services. Even though this is not always like that, you should have an authorization before providing services. When a healthcare provider needs to perform a procedure or provide a service that requires authorization, they submit a request to the insurance company detailing the medical necessity and supporting documentation, such as medical records or test results. The insurance company then reviews the request and determines whether to approve or deny the authorization based on their coverage policies and guidelines. Once approved, they will send a document that will contain the following: patient information. The authorization form will include the patient's personal details such as their name, date of birth, address, contact information, diagnosis code, and insurance policy or identification number. Provider information. The form will also include the healthcare provider's information, including their name, address, contact details, and provider identification number. Service details. The authorization form will specify the specific healthcare services or procedures approved. It will list the name of the service and the procedure code associated with it. These codes help identify the specific services being authorized, ensuring accurate billing and claims processing. Dates and duration. The authorization form will contain information about the requested dates or duration of the services. This could include the start and end dates. Days and hours. Some authorizations may have limits on the maximum allowable units or quantities for specific services. For instance, it may specify a maximum number of visits or hours of services allowed per authorization period or the specific days approved per week. The authorizations can have an impact on billing in the following ways. Coverage confirmation. An approved authorization confirms that the requested healthcare services are covered by the insurance provider or government program. This allows the healthcare provider to bill the insurance company for the approved services, reducing the likelihood of claim denials. Denial of authorization. If the authorization is denied, the insurance company may not cover the requested services. In such cases, the patient or the healthcare provider may need to explore alternative options such as appealing the denial, seeking a different treatment, or considering self-pay options. Payment guarantee. With an authorization in place, the insurance company agrees to pay for the approved services according to the terms of the policy. This ensures that the healthcare providers will receive payment for the services rendered, reducing financial uncertainties. Quantity or frequency. Schedules may specify the quantity or frequency of authorized services. For example, it may state the number of visits approved per week or the amount of hours authorized. Most of the authorizations will specify the days and hours allowed within a specific time frame. Failure to comply with the authorized limits may result in claim denials or additional financial responsibilities for the patient. Reimbursement discrepancies. Billing inaccuracies such as mismatched service codes or units between the authorization and the actual services rendered can lead to discrepancies in reimbursement. It is crucial for healthcare providers to accurately document and bill for the authorized services to avoid payment delays or claim denials. Overall, proper authorization is essential for ensuring smooth medical billing processes, reducing claim denials, and facilitating prompt and accurate reimbursement for healthcare services. Failing to obtain the necessary authorization in advance can lead to the problems mentioned previously. It is important for patients and healthcare providers to communicate effectively with the insurance company, understand the authorization requirements, and follow the necessary steps to ensure proper coverage and minimize billing complications. If you have any further questions or would like to learn more about a specific aspect of the healthcare industry, please don't hesitate to reach out and continue the conversation. Thank you for joining me today. Now, don't miss out this video where I show you when to submit a corrected claim. See you in another one.